Good afternoon, everyone, and welcome to the Henry Schein Dental Academy webinar series. My name is Adam, and I'll be your moderator. Today, we're joined by Laura Seefeldt and Amy Laundre, designers with Henry Schein's Integrated Design Studio. Laura and Amy will be exploring the concept of universal design in dentistry, specifically how to achieve an inclusive and accessible dental practice. If there are any questions during the webinar, please type them into the Q&A section of your control panel, and we'll reply to you via email within 2 business days. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand, and this webinar is sponsored by Henry Schein's Integrated Design Studio. With that, I would like to welcome Laura and Amy.
Thank you for joining us for our presentation on universal design. We are excited to share with you our research on this interesting subject. My name is Amy Laundre. I am a lead designer with Henry Schein's Integrated Design Studio. Laura Seefeldt, supervisor with Henry Schein's Integrated Design Studio, will be presenting with me this evening. Our team at Integrated Design Studio, known as IDS, is comprised of over 22 designers well-versed in dental office design. We work in partnership with our equipment sales specialists across the nation. We offer our services as design consultants, drafting equipment technology placement plans, and offer an extension service for interior design. Let's look at what universal design means with Laura.
Thanks, Amy. I'm sure many of you have heard the term universal design before, but might not understand exactly what it means. I wanted to get started by taking a look at what universal design is. Universal design is the design and composition of an environment, product, or service so that it can be accessed, understood, and used to the greatest extent possible by all people, regardless of their age, size, or disability. I want to talk through what that definition means and highlight a few of the most important concepts. While we will spend a lot of time today discussing how universal design can be incorporated into dental practices, I do think it's important to understand that it isn't a philosophy that's only limited to interior spaces. Examples of universal design can include products or services and are things that we encounter in our everyday lives without even realizing it. I also think a common misconception about universal design is that it's only meant for people who are differently abled. You're probably all familiar with the fact that there are accessibility standards for buildings meant to accommodate people with disabilities. Universal design is not meant to be a synonym or a replacement for accessibility standards. It's meant to create equitable experiences for all members of the population, regardless of a variety of factors, not just an individual's level of physical ability. While the core philosophy of universal design is about creating equitable experiences, that doesn't mean we have to leave behind the importance of aesthetic value. Designing something that's aesthetically pleasing, as well as being highly functional, should be the goal of any good design, and the universal design process strives to achieve just that. Overall, universal design is good design. It produces work that benefits a wide range of people, is highly usable, inclusive, convenient, enjoyable to use, and accessible to as many people as possible. Who are we designing for when we talk about universal design? In short, it's meant for everyone, whether it be age, physical characteristics, demographics, physical abilities, or a range of independence. Universal design focuses on a human-centered approach that will benefit as many people as possible. If you consider the spectrum of users of any given design, you'll see that everyone has a different experience based on those factors. Some people might have no problems with the design at all. Others might have difficulty with some of the features of a design, most of the features of a design, or all of the features of a design. Some people might be unable to use a design at all. The goal of universal design is to minimize the number of individuals who have difficulty with any feature of a design, and to create an equitable experience for all of its users. Because universal design is meant to benefit as many people as possible, it's important to understand the range of abilities that humans might experience. Many of us first think of mobility limitations when we consider the accessibility of a space. Mobility limitations could include the required use of a walker, cane, wheelchair, electric scooter, or crutches. Dexterity conditions can occur with a number of health issues, such as arthritis, Parkinson's disease, or cerebral palsy. Common conditions such as carpal tunnel or tendinitis can also cause everyday products to be problematic for the user. The way that someone uses and experiences a space can also be affected by psychological limitations, such as mental health disorders, developmental and intellectual limitations, or behavioral and emotional disorders. Others might have communication limitations, including blindness, low vision, deafness, hearing loss, or muteness. Language and literacy barriers can also be the cause of communication issues. Those who might experience cognitive delays can also struggle to effectively communicate. People who are considered fully able-bodied also belong on the spectrum of abilities, but even they might experience physical limitations due to inherent characteristics like height, size, or hand dominance. I think of the way that my 5'4" mom experienced our kitchen in the house I grew up in versus the rest of our family, who are all 5'9" or taller. She simply couldn't reach all of the same things that we could. She's an able-bodied person, but because of her height, she did experience some physical limitations. There are 7 widely accepted principles in regards to universal design. And as we approach a design problem from the universal design perspective, we try to achieve them all. Equitable use means that the design is useful to people with diverse abilities. Flexibility in use means that the design will accommodate a range of individual preferences. Simple and intuitive use means that the design is easy to understand regardless of a user's skill level. Perceptible information means that the design communicates information effectively regardless of the user's sensory abilities. Tolerance for error means that the design will minimize negative consequences of unintentional actions. Low physical effort means that the design can be used comfortably and efficiently. Size and space for approach and use means that appropriate space is being provided for users regardless of their body size or level of mobility. So why should we be concerned about any of this? In general, when universal design is practiced effectively, there's a benefit to the individual, to society, and to businesses. In the case of the dental professional, incorporating universal design into your practice can also be a driver of advancing health equity. As universal design is meant to benefit as many people as possible, the ways in which each individual will benefit will also vary based on their level of need or ability. Most people do not function with full capacity for the entirety of their lives. Even someone who is considered to be able-bodied could be affected by an injury, unfamiliarity with a new environment or product, or an inherent physical characteristic. The positive impact that universal design can have on society cannot be overstated. The Independent Center estimates that 1 in 5 people have a disability, and we are all aware that in the United States, we face the challenges of an aging population. Solutions that promote accessibility and usability for special populations can lead to greater degrees of independent living. Universal design can also lead to a more robust participation in society for those who might otherwise have difficulty accessing spaces and services. Effective universal design can also save money in the long term if comprehensive user requirements are thought through and included as part of the initial design, instead of being added on later. Businesses can benefit from implementing universal design by increasing their market reach, improving customer satisfaction, and promoting a positive public image. It can also attract and engage a wider range of employees and boost employee performance and success. In general, consumers today have higher expectations for services, products, and spaces, and feel more empowered than ever to voice their disappointment if those expectations aren't being met. For our purposes, we also see the added benefit of advancing health equity. Creating dental practices that provide equitable experiences for a range of people creates opportunities for underserved populations to receive much needed oral health care. I want to take a look at a few examples of universal design that we're probably all familiar with. Automatic sliding doors are a great example of a design that services those who might use a mobility device, parents with strollers, or someone who might just struggle to grasp a door handle. Tactile strips along sidewalks provide an indicator to the visually impaired that the public access way is meeting the road. Curb cuts create greater accessibility to buildings, outdoor spaces, public transportation, and public access ways in general. Not only does this increase accessibility for those who might use mobility devices, but can also benefit parents with strollers, people who use wheeled carts to transport groceries, and even kids on scooters. Lever door handles and rocker-style light switches are a benefit to those with dexterity issues, but are also easier for almost all individuals to use. Height adjustable desks are a great example of universal design that many people have come to expect in their work environments. High contrast lettering or combining text with symbols aids in effectively communicating wayfinding. Closed captioning benefits those who are deaf or hard of hearing, but is also a valuable tool for communicating with anyone in a loud environment. Now that we've reviewed what universal design is, I want to pass it off to Amy to discuss universal design in dental practices.
Thank you, Laura. How does universal design affect the dental environment? Dental care is the most prevalent healthcare need cited among individuals with special needs. Universal design needs to be considered to help bridge this gap. We will take a tour through a conceptual dental office, looking at areas that can be improved through redesign of some commonly compromised areas. There is a wide variety of users that require additional consideration when looking at design. Patients may have physical, psychological, or communication challenges. The patient may have a caretaker who needs to travel and assist them through everyday tasks. As we review the different areas or zones within the office, we will see how these different groups experience the space. The color-coded groups will be reflected in the bullets under each compromised design or procedural issue. Before the patient or caregiver even enters the building, they are faced with challenges experienced in the pre-appointment stage. Some challenges may be the shortage of dentists who take patients with special needs, lack of accessible routes to the office, or issues with arranging transportation to the appointment. To simplify the process, consider adding accessibility or accommodation information on the office website. Create a Get to Know Your Dentist staff page. Offer phone consultations to assess needs, and offer a Get Acquainted visit. Extend appointment times to allow for unforeseen issues. Look at options for appointment times for individuals who need transportation to the office. For the hearing impaired, text or email notifications would be a welcome form of communication. How to get to the front door? Seems like a basic question, but one that not just the special needs population struggles with. Public transportation is a common form of travel, especially in metropolitan ways. Wayfinding, is another universal challenge. Can you see the front door? Are there signs that are well placed for visibility? For patients with mobility options, is there any accessible parking and curb cuts to allow passage? Are there stairs and no ramps for entry into the office? When considering a new location, choose spaces that have relatively short walks from the transit stop to the office. Look at the accessible route from parking to the front door. Make sure there are an adequate amount of accessible parking stalls, curb cuts to the sidewalk, and an automatic door opener for the door. Make sure the signage and the door are visible from the path of travel and that the route is free from debris. The main entry should also be the accessible entry. Some of the challenges experienced when checking in are obstructions to the clear path of travel, extended amount of time needed for check-in, lack of visibility at the front desk, and methods for updating patient paperwork. In this scenario, we see that the furniture blocks the clear floor area needed for the door operation. The high check writer surface is a feature that allows for privacy for staff, but shuts off communication and sightline for patients who are either shorter or using a mobility device. Solutions to consider would be to create a line of sight from the front desk to the front door, utilizing a desk height opening as shown. Maintain a clear path of travel, consider the furniture, and assume people may be sitting in chairs, and allow extra space for maneuvering of mobility devices. Offer alternate means for checking in, such as an online check-in or touchscreen kiosks. These methods for this check-in help free up the front desk and allows patients and caregivers time and space to do this function without pressure. Consider the provided example, the typical maximize the seating chair arrangement in this waiting room. Patients lack privacy and choice in this scenario. The seats are tightly packed together without space for a mobility device to park or stow. Patients prone to anxiety are effectively on display and cannot adapt their environment. The seating does not allow for any choice in seat heights, table access, or privacy. Look for a variety of ways to make the waiting room hospitable, allowing for multiple seating options and flexibility to adapt the space as needed. By creating micro seating arrangements throughout the waiting area, it allows patients a choice. Higher or lower chairs or chairs with or without armrests to accommodate a variety of heights, body sizes, and mobility ranges. Grouping seating with other open floor areas for parking or stowing mobility aids allows patients and caregivers the opportunity to sit together. Bench seating is preferable for family groups or individuals needing additional space that traditional chairs limit. Alcoves create a more private space to limit visual audio stimulation, which allows patients with psychological challenges a quiet, secluded space to wait. Ceiling treatments can suggest shelter to seating areas without the physical vertical separation of a wall. TVs can provide a welcome distraction to patients. A common issue exists with restroom layouts. The bare minimum of space is utilized and is sometimes questionable if it meets basic accessibility codes. They are designed with a single user in mind, not including a caregiver. Mobility scooters and walking aids like canes may not have the space or hangers to stow them. The location of restrooms can present a challenge for emergency or extended visits to the restroom. To address these concerns and to go a step further, let's look at a solution that attempts to offer more space and amenities that would improve this area. The right image illustrates an oversized restroom with the aim to allow additional space for mobility devices and caregivers. The left image shows a more specialized bathroom design that would be appropriate for an office that sees a larger population of individuals with special needs. Additional features in the solution include a rinse station for accidents and seating for caregivers or parents with children. Consult rooms are set up to allow a private conversation between the patient or patient and caregiver with office staff. Consider the space constraints and lack of adaptability of the common consult room. In patients with psychological issues, unfixed furniture may become a projectile. Lack of visual aids makes it difficult for the hearing impaired to follow the discussion. This space also doesn't provide a quiet space for the patient with psychological challenges, which could translate into interrupted or incomplete communication between staff and caregiver. Consult room solutions involve increasing the dedicated area to a larger room with a quiet prep room adjacency. The furniture is shown as fixed, with seating options allowing for mobility devices to be used and operated within the space. Additional seating is provided for caregivers or other family members involved in these discussions. A monitor to display information is provided on the wall, helping to illustrate the conversation for the hearing impaired. The quiet room with glass door allows the caregiver visual access to the patient while having a private, uninterrupted conversation. The room itself allows the patient a relaxing space to rest while the conversation takes place in the next room. Next, Laura will share with us the clinical treatment zone challenges and solutions.
Thanks, Amy. Next, I want to discuss the imaging alcove. When space is tight, the imaging alcove is often crammed into the smallest area possible. This can cause several issues. Access into the room can become minimal. Of course, a small alcove can make it very difficult for someone who uses a mobility device, especially a wheelchair or scooter, to access the X-ray equipment itself. It can also impede on the operator's ability to access the controls. For patients who may require a caregiver or for families who come in as a group, there is often not a place for additional guests to stand other than along the traffic of the main hallway. Senior patients or those with specific physical limitations might have a hard time standing or staying still while the images are being taken. Even for patients who might not struggle with access into the space, there's often nowhere to place personal belongings while having images taken. There are some simple solutions that would improve this space for all users. Recessing the alcove off of the main hall a bit provides space right outside of the alcove for guest seating. This can also serve as a spot to keep personal belongings while having your images taken. We recommend making the opening into the alcove as wide as possible and positioning the X-ray equipment with the most direct approach as possible. Sizing up the imaging alcove also ensures enough space for the operator. Think about how much clear floor space is inside the alcove to make sure that you're providing turnaround room for someone who uses a wheelchair or an electric scooter. Adding a small stool to the space that can be pulled up to the X-ray unit can assist those patients who might struggle to stand or remain still while images are being taken. Corridors are a really good example of a minimum requirement being unrealistic. In general, the minimum required width of a hallway is 3 feet 8 inches. We typically recommend 4 feet 6 to 5 foot wide corridors based on the size and layout of the practice. Narrow hallways are problematic when any two people need to pass by one another or for an individual in a mobility device. There often is not enough space for someone in a wheelchair or a scooter to turn around in the hallway. If a patient needs to turn around, he would have to enter a room, rotate the device, then leave the room again. Many of us now are more aware of physical distancing than ever before, and narrow hallways can be unsettling to those who might be concerned about their proximity to others. Flooring transitions from the corridor into other rooms can also be an issue for people who use mobility devices or who are just at risk of tripping in general. Individuals who experience either physical or psychological limitations might also need a place to stop and rest or regroup when they're traveling from the public area into the treatment zone. Corridors in general can be confusing for anyone who might have to navigate a space that they're unfamiliar with. Like I mentioned, we recommend a corridor width of 4 feet 6 to 5 feet wide. At 5 feet wide, someone in a mobility device will be able to turn around in the hall. In general, providing more space in the hallways for people to pass by one another is also just a good design principle. As people continue to be conscientious about distancing, providing more space along high traffic areas can also help to reduce discomfort among all patients. Make sure that the flooring changes from hallways into rooms transition properly. Avoid flooring that has a significant change in height and use transition strips to avoid tripping hazards. Working in bench seating along a corridor can serve multiple purposes. Those who have mobility limitations might use this as a place to sit down and rest when going to and from the treatment room. For people with behavioral issues who might be experiencing elevated anxiety, it's a place to sit down and regroup before entering the treatment space. Patients who might require a caregiver often have a range of independence. Some might benefit from having a caregiver nearby, but might not need them in the treatment room for the entire duration of the procedure. Seating along the hallway provides a space for support nearby while also allowing the patient to maintain a sense of independence. When designing your practice, think about the patient path of travel through the hallways and work with your designer to find the most intuitive solution. Taking advantage of signage or material transitions can also help indicate the direction of travel. There are many challenges in treatment rooms for individuals who might be differently abled. Like other patients, they might experience elevated anxiety about the treatment process. Those who have emotional, behavioral, or intellectual needs might not be able to manage their anxiety as well as others and might feel the need to act out. Minimally sized openings into the room may not be wide enough for all people. In a typical treatment room, there's nowhere to stow a wheelchair or other mobility device while the patient is in the dental chair. For those same patients, transferring into the chair might also be a struggle and could present an opportunity for injury. If a guest or caregiver is accompanying a patient, there often isn't space for that person to sit. If a family comes in for multiple appointments, there isn't space for them to stay together in the treatment room. For all individuals, there's often no place to keep personal belongings. General lack of privacy is also an issue for all patients. The noise in a dental practice can be distracting or upsetting to a patient who has psychological limitations, but is also something that most patients would prefer not to hear. There are two different types of treatment room solutions that we want to review today. The first is one that we would consider to be barrier-free. This option is one that we would recommend for doctors who might want to provide and market services specifically to patients with physical limitations and are wanting to dedicate space to a room that is specially designed for those who use a wheelchair. We would start by suggesting that you locate this room near the front of the practice for easy patient access. Ensure that openings into the room will accommodate wheelchair access and consider sizing up from the minimum requirement. Doors on this room will also help to maintain privacy and control noise. Rather than transferring a patient from a wheelchair into a dental treatment chair, we would recommend using a wheelchair tilting device, which allows a patient to position their wheelchair on a tilting deck that would recline for treatment. For a room that is meant to be truly barrier-free, we also recommend adding extra depth to the room to accommodate a turning radius for a wheelchair or scooter. This also provides plenty of space for extra guest seating. Another suggestion that we would make for a room of this nature would be to provide a small prep room directly accessible to the treatment room. We know that behavioral issues might sometimes overlap with physical disabilities, and some patients might need space and time to transition from the waiting room into the treatment room. Patients with developmental limitations can benefit from being prepped for their treatment. This room provides a space to educate patients on what is going to happen during treatment, introduce them to the instruments that might be used, and answer questions. This prep room can serve multiple purposes. In this plan, we've placed it next to consultation so that it would double as a space for patients who might also need a quiet area while the caregiver is discussing treatment with the provider. This room could also be used as a private waiting space for families or guests of patients. We also highly recommend including patient entertainment in this room. While TVs in the ceiling are popular with all patients, it can be especially effective for distracting patients who might experience psychological limitations. The next solution that we want to take a look at is one that we consider a multi-purpose space. Our suggestion here is to provide a slightly larger room that would better accommodate patients with mobility issues, but is also a space for patients who might require more privacy throughout the treatment process. In many offices, there is a treatment room that ends up at the end of a corridor. Closing off the hallway to be included in the treatment room and adding a door creates a larger room while not having to take up any additional square footage from the rest of the office. Rotating the orientation of the treatment equipment provides a turning radius at the toe end of the room and makes it easier for the patient to approach and transfer into the dental treatment chair. A larger room also provides plenty of space for a caregiver or for accommodating family appointments. Providing a quiet room with a door reduces sound transfer. In general, we see more and more requests from patients for privacy during treatment, and this room provides a more comfortable experience for those who might be sensitive to privacy or just might be experiencing a longer treatment. The checkout area is another part of the office that we want to take a look at today. All patients might have a hard time locating the checkout, and those with low vision or blindness may especially struggle. There is often limited space for multiple people and for mobility devices. Some patients may not be responsible for their own payment or to reschedule their own appointments and could use a space to wait while their caregiver manages the checkout process. If no accessible counter is provided, patients in a wheelchair or scooter won't have an equitable experience when communicating with staff. Sound from the clinical zone can be distracting or unsettling. Patients who might be upset from the treatment process could create a disruption for others. Patients who have lower levels of independence might require more time and attention during the checkout process. For easy wayfinding, we suggest locating the checkout along the path of travel on the way out of the clinical space. A tactile flooring transition can aid blind patients in locating the checkout desk itself. Creating more space at checkout makes for a more comfortable experience for all patients, but especially for those with a caregiver, in a mobility device, or for families. An additional space recessed off of checkout can accommodate those patients or for additional patients who might just be waiting in line. Providing doors between checkout and treatment can mitigate noise transmission and create a more private experience. Amy spoke earlier about providing a lower height counter at the reception area. Accessibility standards only require a low counter at one location, but we do suggest including it at checkout as well to provide a positive checkout experience for everyone. In this plan, we also developed a checkout space along both sides of the business desk. One checkout provides a semi-private sit-down area for those who might require more time and attention at checkout. You'll also notice that we added an additional exit at this checkout so that patients who might be upset from their treatment have a private space to leave without passing through the waiting room. Of course, offering chairside checkout is another solution for any patient who might have limitations. While universal design is meant to benefit a variety of people, we cannot stress enough how it can positively impact individuals with disabilities. We want to close today by highlighting Henry Schein's commitment to advancing access to healthcare for special populations. There are over 60 million Americans with disabilities, and the #1 healthcare problem that many of them report is finding competent dentistry. Less than 3% of people in the US who have intellectual disabilities can find a dentist who will provide specialized care. For over a decade, Henry Schein has advocated for individuals with disabilities and their accessibility to dental care. Our partnerships include the National Council on Disability, Project Accessible Oral Health, the Special Olympics, and the Viscardi Center. For almost 2 years, Henry Schein has been formally partnered with the National Council on Disability to better educate medical and dental professionals on providing care to individuals with disabilities. Our 5-year goals include collaborating with coalitions to advocate for the importance of oral health care for individuals with disabilities, developing sensitivity and competence training for students who are entering the healthcare profession, developing training and upskilling for current healthcare practitioners to better serve special populations, working with our supplier partners on specialized equipment necessary for special needs care, and supporting the clinical work of those who serve individuals with disabilities. And now Amy is going to take a moment to highlight one of our customers who specializes in serving patients with a range of disabilities.
Thank you, Laura. Lee Specialty Clinic, a Henry Schein customer, offers a wide range of services for those with intellectual and developmental disabilities. They are a driving force for specialty care, aiming to not only care for this population, but to educate medical and dental professionals in the latest techniques and skills needed to effectively treat these patients. The clinic is lauded as a pioneer and a beacon of light for families and patients in this underserved population. Their numerous patient and caregivers' testimonies all speak to the quality and sensitivity of Lee's mission statement in action. For more information about the Lee Specialty Clinic, please see their website at leespecialtyclinic.com. Universal design is a win-win situation, benefiting and improving the lives and experiences for all patients. Universal design aims to make dental offices a place that removes barriers so that regardless of the disability, patients have access to dental care. While not every scenario is possible to enact in an existing office, any improvements made will be a step in the right direction. For further educational opportunities, we invite you to view Henry Schein's webinar series with Dr. Maureen Perry, Breaking Down Barriers to Care, Treating Patients with Disabilities, available now on YouTube. Thank you for sharing your time with Laura and I. We sincerely hope our presentation has inspired conversation that will lead to change, making the dental profession a more inclusive and compassionate environment for all.
Thank you both for the great information and design inspiration. If anyone would like to get in touch with the Integrated Design Studio team, please feel free to reach out directly, or you can email us at webinars@henryschein.com. As a thank you for attending, everyone will receive the recording of this webinar via email sometime in the next week. I'd like to thank you all for joining us. We look forward to seeing you back here on future webinars. Have a great weekend.